Hello to the Inside Access Control community, and welcome to another edition of Global Insights in Professional Security, where we cover major themes in the security space. I'm Michael Gips, your host. This time, we're going to talk about crisis management, and particularly the role of drills, tabletops, pen tests, red and blue teams, and all sorts of other exercises. We're going to look at the benefits and drawbacks of each. And to help us do that is Aric Mutchnick. Aric is a security consultant, trainer, and instructor who focuses on crisis preparation. Welcome to the show, Aric.
Yeah, thanks for having me on.
My pleasure. Just for full disclosure, I do some work with Aric, which I find fascinating. So I had to ask him onto the show. Okay, let's start with simulations and simulations gone bad. We've seen so many of those cases. Just one example, in December 2018, there was an active shooter drill at Lake Brantley High School, Altamonte Springs, Florida. Gunshots rang out as teachers and students barricaded themselves or ran terrified through the halls. No one told them there was a drill going on. We see so many of these cases where people get hurt, they panic, and later on, school boards are hit with lawsuits. Is there any place at all for these kinds of simulations, unprepared or they're told in advance?
Is there any? I mean, maybe only in the slightest sense, because every facility, every organization is different. So could it sit well with a certain organization somewhere? Possibly. But I would say overwhelmingly, it's not a useful idea, and we have to understand where it comes from, right? Because these live drills come from trainers who are former police or former military. And when you're in the police or military, you learn throughout the course of your career, like literally from day one, the more realistic the training, the better the training, because that's how you will react in a similar situation. That is true from a tactical perspective. But when you try and introduce that kind of training to a civilian population, I would ask, where are the benefits? Unless, let's say, a high school was going to sign up for that training 5 times a week for an entire semester, you're just not going to get the muscle memory that you're looking for. And that realism that you think is going to be helpful to the population ends up being traumatic to the population. And when they adjust and try and make it softer, their version of making it softer is going from simunition rounds to paint rounds. So it's still basically following the same path. I do in those training programs for the tactical teams. Even if it's a school security team, if the building's empty and they want to run a live exercise to train themselves, that's a fantastic idea. If you want to empty the building and invite police to run an exercise, that's an even better idea, because you want them to be familiar with your facility. But to have, certainly kids, never. I don't see the value in that at all. But if you want to have civilians in there, then it just needs to be a different type of training that doesn't involve a realism that's kind of valueless once you reach the end. So.
Yeah, no, excellent point about being tactical and about doing this training for the security staff and the police when there's an empty building. I was reading a case about there was a 3-year-old kid who was running around his house, hiding behind chairs and couches and pillows. And he was saying, active shooter, active shooter. And they're like, where are you getting this from? And apparently he'd been drilled so often at school on active shooter. He was thinking that there was active shooters everywhere. And he started to have PTSD from it. So it's crazy. We certainly understand, the thought behind it. You want to be prepared, but we have to look at the consequences. So I wanted to move on to the different types of exercises. There's so many ways to do, crisis management preparation, drilling. So I'm going to name a couple, 2 or 3 kinds. And if you could tell me the pluses and minuses or the benefits and drawbacks. Tabletop exercises. What about those?
Tabletops are great for several reasons, but tabletops create awareness, in an organization. They allow you to have useful discussions. They help to develop, or they help to review policies that, maybe you wouldn't discuss in other settings. And it's a safe setting, right? You could sit around the table and talk scenario, and there's literally no chance that somebody is going to have a traumatic outcome. Unless the conversation at the table gets really heated, but typically it's good for building that awareness and, just creating a conversation that's useful. So I encourage tabletops in general.
So where do they not go far enough?
So the issue with tabletops comes in two ways. One is, think about who sits at the table at a tabletop. It's usually headship, management. It rarely involves perspective from those people who are on the ground. A tabletop at a school certainly wouldn't involve a student, although I would say student leaders should be involved in those tabletop exercises. But you don't get the perspective of everyone that you want. The second element of a tabletop, I think, that makes you want to do more than just a tabletop, is the fact that tabletops are really there to review policy, not create policy. And there's a comfort factor. You're sitting around the table, you're sort of talking about it, getting the juices flowing to a certain degree don't happen. I'm not saying you need a realistic exercise to do that. I'm just saying that when you're sitting around the table, it's the dynamic doesn't always lend itself to creativity in terms of how do we deal with a certain situation.
Those are really good points. Talk about literally having a seat at the table. The people who don't have a seat at the table are arguably more important, for these kinds of exercises than the people who do. Okay, the next one, red and blue teams, and can you tell us the difference between those?
Blue I actually haven't heard of.
Okay.
Okay. Red I'm quite familiar with, but blue I have not.
Okay, go ahead with red teams.
Red teaming. So red teaming or penetration testing. That if anybody listening to the cast is old enough to remember the movie Sneakers with Robert Redford and Sidney Poitier, great movie. Watch it if you haven't seen it. Basically, the idea is to be the bad guy and break into a building, or test the security access, test personnel, test communications in a live setting. It can go all the way from sort of literally trying to sneak in and just get past security to full-scale exercises where you're testing the combat readiness of an armed security team that's guarding a nuclear facility. So there's certainly gradations of a red team. My company Experior Group, the name Experior is to test. I literally started the company because red teaming is a lot of fun. That's like, those are the football matches of security. That's when you come in and you're like, yes, we are going to be smarter than you and get past everything you put in our way and show you why you need to prove why you hired us in the first place. So those are great. They're great exercises. So that's red teaming and penetration testing.
And we heard both the pluses and the minuses when we were talking about the realistic drills, right?
Correct. Well, and I would add one to red teaming is that there are delicate egos involved, certainly in security. And even with those, let's take a, security guard, like $12 an hour guard. When you break past them and show them, this is what we're better than you, like you're a professional consultant getting past a security guard, it can be demeaning to that guard and affect them emotionally. And higher end security, so a security director might get really angry, because you're sort of going, neener to a certain degree. And the fact of the matter is that's not always conducive to an environment of growth, let's say. So that can be a negative fallback of red teaming. Also, teams that conduct the red team can get out of hand. There's several famous stories of red teams gone wrong because they got a little too excited about what they were trying to do, and then people ended up getting hurt, or certainly people got scared. So that's one of the drawbacks of red teaming as well.
Yeah, no, those are really good points. You don't want to humiliate your staff. And then finally, something that you call rolling tabletops. What's that?
So rolling tabletop exercise is the same idea of a scenario-based, discussion-led exercise, except instead of sitting in a room around a table, you're physically moving through the space so that you can capture variables that you're not going to find in a conference room. Think of it, I would say think of it like this. you can do route analysis. You can do route analysis using a map, or you can do route analysis driving the route. You know which one's going to be really better to gather more information. Driving the route simply going to allow you to see dynamics that you would never see using a map. Can you do route analysis using a map? Of course you can. You could see the route, you could sort of see things, you could use, Google Maps and get even more detail, but it's never the same as physically driving the route and feeling that route. And that's the difference between a rolling tabletop exercise and just a standard tabletop exercise.
And some of the benefits
are certainly a collection of variables that you're not going to get in the conference room. So you're physically moving through the space. You're engaging people where they sit. So instead of pulling a security guard from a lobby into a conference room to talk through a scenario, you're having that security guard sit at his or her desk and think through a problem together. And when they're sitting in their space, it just creates a realism. I'm not afraid of realism. I just don't think that tactical realism is necessary for a facility, but realism with regards to they're sitting at their desk, and if they have a panic button, they're looking at that panic button. If they have a phone they're going to use or a radio they're going to use, that radio is right in their hand. So you simply get more value from running that in the space. Certainly as you get past that security guard and move on to other aspects of the facility. Things like a termination. I could sit in a conference room and discuss terminations with HR, or I could say, look, from the moment that person would see a pink slip, walk me through the process physically through the facility. And when you do that, you discover things that you would never discover in a conference room. And I've seen it at companies where they literally, that person has to do the walk of shame across a factory floor, and everyone knows where they're going, and they know where they're going. And now suddenly it becomes an embarrassing situation, which can lead to a violent outcome. So walking through and physically looking through that space is, I would say, critical for things like that.
And where could it be better? I would imagine that people can opt out of this exercise so you don't get the full spectrum of insights.
They can. In my experience, when we've run, rolling tabletop exercises, there's only been one person out of the hundreds of scenarios we've run that has said, I would prefer not to. I take that back. There was one person that said, I don't want to. 4 other people said, no, I don't think I want to do it. But then when they actually heard about the rolling tabletop, they had said, oh, now I see how it works. Can I run one now? So they actually came back and decided to run it anyway. But one person did say, I honestly don't think I want to do this. And we said, no problem. If you're not comfortable with it, then we won't run it with you. And again, we're not there to question their psychology. We're there to get information. And no one person is going to have the end all be all of information that's going to create a lack. So.
Gotcha. So you've done a lot of these exercises, scenario-based, rolling tabletop exercises, where you actually walk through the facilities. What are some of the takeaways from actual exercises that have surprised you?
What have surprised me? There are so many. So when we're doing them, because the way we run rolling tabletop exercises, it's not a gotcha exercise. It's a conversation. In fact, we tell them that. We say, hey, look, this isn't a test. It's a conversation so that we can discuss process together and come up with policy or procedure that is maybe more meaningful. And when you approach people and say, I need your help based on your knowledge, you get better information. And there's a comfort level that you're just not going to get when you're trying to surprise them. So some specific takeaways would be, one was at a major healthcare system. We were running a rolling tabletop, and it was with, we came upon 12 registered nurses at the front desk. And the scenario we wanted to run with them was basically they hear a code silver over the PA system. Code silver for this healthcare, many healthcare systems, is an active shooter code. And so we start the conversation, and I say, okay, so you hear code silver over the PA system, go. And as a trainer, in my mind, I sort of, this as well. You want to lead them in a certain direction, right? Like you want to sort of create that environment. Before I could even do that, a nurse raises her hand. She goes, can I say something? I'm like, sure. She goes, I would never hear that code silver. And I'm like, what? So it was all stop. And I'm like, I did not expect that. I'm like, would none of you hear the code silver? And all of them said, no, none of us would hear the code silver. I was like, why? And they're like, do you know how many codes they call over the PA system every single day? I literally have to tune them out or I'll go crazy. I don't even think I'd hear my name on the PA system if they called it out. I was like, well, well, that's a real problem, because what's the point of code silver if nobody's listening? And I'm like, well, is there anything you do here on the PA system that, that stands out? And another nurse raises her hand and she goes, well, we're a Catholic hospital system, and every time a baby is born in the hospital, they play a little snippet of the lullaby on the PA system. I always hear the lullaby. I'm like, interesting. Do all of you hear that? And all 12 of them said, absolutely. We all hear the lullaby. So what I'm understanding now is that a sound that's recognizable is more informative than the verbal language of a code silver. I'm like, okay, well, you're 12 women. Let me ask one guy just to get perspective, and see. So there's a, off-duty county sheriff that's standing in the lobby armed. And I go to Steve and I say, Steve, PA system comes on, code silver is called, go. And I'm saying this in quotes, so pardon my language, but he goes, oh, I wouldn't hear that shit. And I go, Steve, you're police. Like, you're here for security. How could you not hear a code silver? And he goes, okay, first of all, if the code silver is coming out, it's coming on my radio. I always hear it on my radio. I'm like, okay. And he goes, second of all, do you know how many codes they call on that PA system every day? I would never hear it. And I was like, well, out of curiosity, is there anything you do hear on the PA system that makes sense to you or that stands out? He thinks for a second and he looks at me and he goes, I always hear the lullaby when they play it over the PA system. So now I go to the security director. I'm like, here's your communications problem. And you need to think of a sound that you can emanate, and don't use it for Phyllis's birthday or any other event, but for a armed threat in the building, that should be your sound. He gets excited. He goes, that's a great idea. What if we play the theme song from Jaws? I'm like, that's a terrible idea. Please do song from Jaws. And he's like, what about Rise of the Valkyrie? I'm like, wait, you don't want to empower the shooter as they're moving. You don't want to play. So later on, they realized they tested sounds and they passed it by people, and they, in fact, changed their policy and changed it to a sound, which was much, much more effective than that language. So that was one of the bigger surprises early on when we were running these exercises.
That's a fantastic example. So you mentioned the healthcare environment. Are there general themes in holes in their crisis preparation that cut across industries, or does it vary, where you see the same kinds of things over and over, or does it vary by industry, say in healthcare, where they may have that problem that you mentioned, or by geography or by other factors?
I would say both. So there are certainly things that are healthcare oriented because of the dynamics of an ED or an ICU. Like there are clear issues there. Let's take an ICU. If you talk to nurses and say there's an active shooter in the building, run, hide, fight, they're going to say, I'm not going anywhere. I'm in a pediatric ICU. I've got 10 beds of kids here. I'm not leaving this room. Right? So suddenly it doesn't become a run, hide, fight issue. It becomes a let's discuss process issue. And what are the dynamics? If you're really not going to leave, how do we make this the safest place for you? So that's one sort of healthcare dynamic that comes into play. Across industries, an easy one to pick on is a panic button. Healthcare, the issues with panic buttons are a little different because they wear their around the neck communicators. A lot of hospitals have that. And there's like a 30-second delay once you press the button. Yet they rely on that for emergency communications. Imagine trying to communicate an emergency and there's a 30-second delay when you press the button. You might as well take a nap at that point. So, so from a healthcare perspective, that's specific, but panic buttons across industries, I see when there is a panic button, usually when I'm running a scenario, they forget that it's there or they don't bring it up. They don't mention the panic button. And so I'll say, I mentioned the panic button. Oh, right. The panic button. I'm like, have you ever pressed that panic button? No, I've never pressed that panic button. Do you know what the panic button does? I think it calls the police. Panic buttons almost never call the police. Are you afraid to press that panic button? I am afraid to press that button. But why? Because they've never pressed it in their lives and they think that it wakes up the president. So what we do is have them press the button so that they can physically see the dynamic. Forget about panic buttons that are on Velcro and can be easily moved around a desk because people do that all the time. And then that's why they don't know they're there because they move all the time and they've forgotten, and that's when you get accidents because they think they're opening the door with the button and they're actually pressing the panic alarm. So now they owe the city $55, for a false panic button press. So, those are the kinds of things we discover across industries. there's many more, but, I would say easily there's both. There's, manufacturing facilities, major sporting events, convention centers, museums, like they all have their sort of unique aspects, but there's also stuff that clearly goes across all of them. So
Those are great examples. Thank you. One final question. Now staff are coming back to the office, in some places slowly, in other places they never quite left, but so they're coming back after COVID, and the facilities may have been re-engineered. They may be different access controlled. There may be different health and safety protocols. And with everything, they may be more socially distanced, new workspaces. And they may be able to barely remember how to get to the bathroom or figure that out with all the new changes. So, and much less react to a threat. So, how do you deal with that? People coming back to the office and they don't know anything anymore, or everything has changed. Is that a good thing for crisis management? So you can get to them, there's a fresh slate, or is that a challenge?
I would say it's good in the fact that we have an opportunity to re-engage staff on the issues of safety and security. That's a challenge for literally every CSO in every company in the universe, right? Like, where's my real estate to provide the information that staff needs? And usually that's onboarding for new hires, or if they're lucky, refresher training throughout the year, if HR provides it to them for another 15 minutes, so there's a constant battle there. So now it is an opportunity, everyone's thinking about safety, which luckily security goes hand in hand with that to a certain degree. But the issues, we were actually brought into a company specifically because they were concerned about the return to office, and they wanted to run scenarios based on anxiety that would be present upon return, dynamics of the office, certainly from a safety security standpoint. And what we discovered was much, much more. And that's because it's critical to get perspective of the staff that will be using the office. Even if there's only, 30 people in your office right now, it's good to get their perspective on sort of how are things working here? Is it okay? And here's our plan for, our phase 3. Is this, do you have any thoughts on that? And, I guarantee everybody has thoughts on that. So a couple of the takeaways from that were, one, all your staff that have been out of the office for a year and a half, or more, they need to be onboarded again like they're new hires. Not just for safety and security, or if you have to retrain them on first aid, but I guarantee they don't remember their elements of the employee assistance program. They don't remember who a floor warden is or what they even do. They don't remember the number to the help desk if they click the wrong email and suddenly they get a phishing scam. So, or hit ransomware. So onboarding everyone from an infosec, security, HR, anybody that's involved in your onboarding needs to be involved again, and you need to redesign it. Don't just give them the onboarding training, redesign it so you're prepared and dealing directly with issues that arise from COVID. The other, and this is a big one, so simple, but a big one, somebody brought the idea in a conversation of the fact, like, who's in charge of the transition back to the office? Usually it's yet another hat that's put on the CSO or environmental health and safety or HR, or certainly facilities has to deal with that. The problem with that is if you just put another hat on facilities, well, they're already wearing 65 hats. So now their focus isn't on transition back to the office. Transition back to the office is just sort of like another peg that they have to deal with in the overall scheme. And there was one rolling tabletop exercise where a staff member was like, when we moved to a new office, we had somebody who's in charge logistically of that office transition to the new space. Literally someone whose sole job was to make sure that transition to the new office from every standpoint, IT, safety, infrastructure, was all in place. Why do we not have somebody like that for COVID? I was like, that is an awesome question. And I'm like, that absolutely. Hire somebody with an EHS background or a facilities background whose sole job it is to bring people back to the office and transition them in from a COVID perspective. With all the dynamics of COVID, that whatever your office wants to do, if you're going to require vaccination, fine. Have somebody who's overseeing that. If you're not going to, but you're going to have distance, fine. You need somebody whose sole job it is to look after that, or else you are going to run into problem after problem because somebody didn't ask the right question. But if somebody's focused on it, they will ask the right question. And you're just going to be facing a lot less of a dynamic of resistance when people are coming back to the office. Certainly from a safety and security perspective, the more opportunity you give for people to have anxiety, the more they will. And anxiety leads to anger, and anger leads to conflict, and that's just not what you want to deal with in the office at all. So,
Well, Aric, we're out of time, but this has been fantastic. I find this so interesting. Every exercise, every interview is a million stories come out of that. A million little nuances. So, it's really good stuff. Thanks for being on the program, and good luck.
I appreciate it. Thanks so much for having me, and be safe.
You too. Thanks.